even if things are kind of, fairly straightforward, there are dynamics at play, and it's never kind of one thing or the other. Like, things change, and there's a complexity there which means something particularly in terms of human relationships. And that's worth paying attention to.
What were some of the first penny drop moments that you had with psychodynamic theory?
The idea that we have an unconscious, or, if put it in different terms, there's more going on than meets the eye. And I find that a really, really powerful and interesting idea. And I could relate that to my own experience, which I talked about before, either in that sense of dissatisfaction with work. There were some good reasons why that was the case, but there was something inexplicable about it as well, because, it was work I'd liked doing, and then sort of increasingly decided I didn't want to do. What was going on there? What was changing for me, or what was being stirred up there in relation to where I was in life that I didn't sort of understand yet or know about. So, there's this idea that there might be more going on than meets the eye, and that's worth exploring in some way. It's the same with, the depressive episodes I had. There was sort of, in a way, good reasons for me to feel, for me to struggle at those times, but there was also, it didn't quite make sense. Why did I feel the way I did, particularly? Why was it as difficult as it was? So, I guess I was sort of aware as I read that there's something about psychodynamic theory and the way we work as psychodynamic practitioners that asks that question: what else might be going on here that we can think about? Sometimes people come into therapy with me, and there's lots of things that are going right, and yet there's still something that's kind of they can't put their finger on, or that they're struggling with. At other times, there are things that are going on that are quite difficult, but again, that on paper you might say, well, I can expect this to be difficult, but the way I'm kind of reacting, the way I find this difficult, there's something there that I'm confused about, or uncertain about, or sort of doesn't quite make sense. Someone might struggle with a breakup, or with, a transition in life, but they might be struggling in a way that they hadn't anticipated. And so you can sort of bring the same inquiry then, what is it about you that means in this difficult situation, you're reacting the way you are, as opposed to the way someone else might react.
So, for example, something happens to someone and they feel angry about it, but that anger persists or is vastly disproportionate to the situation. They might think, I have every reason to feel angry about this, but there's something more going on here because my friend doesn't feel, who is in the same situation, the same way.
That's a really good way of putting it. I think the word proportionate is a useful way of understanding it. Someone notices that the way they might be reacting or feeling, and by the way, it doesn't necessarily even have to be a sort of a one-off event. It might be, a dynamic with a colleague, or, someone in their personal life where there's something happening that in a way doesn't quite fit or shouldn't be. And they might notice that or come to notice that, come to wonder about that through the therapy. They might know they're struggling, but they haven't really understood more about why they're struggling in the way that they are. And that's often a good starting point for a psychodynamic therapy.
If someone comes in with an idea about that, where do you then start in terms of the therapeutic process to help them address that? I
guess often that starts with what's going on, at the point in their life where they're coming into therapy. If they're feeling things, what are those feelings? How much do they know about those? How do they think about those feelings? What are those experiences like? So in a way, it starts with, just exploring someone's experience. Often people think about what the differences are between approaches. I think it's also important to think about what's common to the approaches. They're all based on a relationship between a therapist or a counselor and their client. And it's about that, that sort of exploration and the space in which someone can explore what's going on for them. I think then beyond that, one of the things that I understand to be part of psychodynamic practice is to also invite someone to think about their experience beyond what might be happening in the immediate situation. Their previous experiences might have a part to play in the way that they're thinking or feeling or reacting in a present situation. Freud wrote a lot about that, and he wrote a lot about development and the focus on early years particularly. And I think there's a lot that makes sense there for me as a psychodynamic practitioner, both theoretically in the way I've understood it, but also in practice with my clients, that we find connections between things that have happened particularly earlier on in someone's life often, and the way they might then sort of think or feel or react in in situations or transitions, or in relation to events in their present life.
There are things that happen to us to which we can still be reacting, or we can still be in process that we're not aware of. By inviting them to go back to those experiences, you're inviting them to consider to what extent those experiences are still playing a part in their present life.
Throughout our lives, we learn about the world. So as we go through the world, we learn stuff, right? We're faced with new situations and new things we have to deal with. We do our best to do that, and we learn something, and we take what we learn in, and then we apply that in the future. Now, I don't just mean in terms of, consciously we have a problem to solve, and once we've solved it, once we know how to solve it. I think it can also be happening at a more unconscious level. If we start to think about what that means in relation to particularly relationships, which is often what psychotherapy is about, and counseling, people bring in often problems related to relationships with other people. We think about what that means in terms of a person's life and their development. Early on in their life, when they're very young, that's the first time that they're encountering other people. Their parents, their family, their extended, their sort of family or network of friends, and they just by necessity are then learning something about how to have relationships with other people, more or less usefully. So that's happening all the time when someone is young. So those are really foundational, years in terms of what we learn about relationships and how to negotiate those, how to have our needs met, ultimately our emotional needs met. And unsurprisingly, then, when people feel they need to come and work with a counsellor or psychotherapist, there might be a useful way of exploring those connections then between, again, what's happening now, maybe in their relationships, particularly problematic ones, and what might have been happening earlier on in their life.
So when you say that people can learn about how to be in relationship in an unuseful way, what can that mean for someone later on?
I guess the dynamics of a present relationship might stir something up for you that relates to an earlier experience, which sort of has to do with what's going on in the present, in the present, in the sense that there's something happening there that might not be easy, but the way that you then feel about it or react to it might also have something to do with, a situation, a relationship earlier in your life that also wasn't straightforward, where you maybe learn something in the way that you do about what happens if, what happens when. We think about parents particularly, or siblings in psychodynamic work. Those are people in your life that might have struggled in their own way to have relationships with people around them, and that plays out in some way. So, people might have parents who are angry or anxious, and they have to sort of deal with that and learn to deal with that very early on. And they take that in. So if we think about development as a sort of learning experience, they're taking something in there that means that it wasn't always easy necessarily to deal with those situations or those relationships. And in a way, they take that with them then into their future or grown-up life. And then maybe, when things get difficult, that kind of plays out in some way.
And that's then maybe the signal that invites them to come to therapy.
Yeah, I think in my experience, people often come to therapy when they're in a crisis that they feel they can't manage themselves anymore, and are then maybe ready to think about what else might be going on and how else they might understand the way they're feeling, which then, goes back to what I was saying before, then invites kind of an exploration of what else might be going on here, which might then include thinking back to other times in their life that don't necessarily feel like they're directly connected to what's happening in the present, but might come to kind of, be relevant in some way.
An experience I had during university where I was living with the three, and then the following year we decided that we didn't want to live together again. And the other two went off and went to a new house, and I went off into a new house on my own. And at the time, it seemed like a very straightforward thing. I was like, it's either going to be us all going separate ways, or it's going to be two of us going separate way. But later on, I looked back on that and thought, maybe I didn't feel as okay with it as I thought. And maybe it's affected how I am in groups now, that I maybe have a tendency to feel as though I'm going to be excluded at some point.
I think it's a good example in a way of what I'm talking about. It meant more to you later on than it did at the time. And maybe that it wasn't as straightforward as you thought it might have been at the time.
What were some of the biggest lessons that you learned from the point at which you qualified to, let's say, 3 or 4 years in?
I'm learning by doing maybe more than I ever did by being on a course. I mean, that got me started. I was then able to sort of take that knowledge that I learned consciously, cognitively, and use that to help me sit with a client and do the work and do the exploration and, make those connections. But the way I've really learned something about that is by doing it, by working weekly with my clients in the way that I have for all those years. It's really hard to pin down because it is less sort of theoretical or, about a specific thing that's done or isn't done. It's something I feel has happened by being in sessions with clients over that time. So it probably is about how you can be with someone in a room.
We had a lecture and there was something about his presence in the room which was very striking. The way that he could hold the room without saying anything and without demanding anything of anyone. Just he had this intangible thing about him. You could call it charisma maybe, but charisma in a therapeutic sense would be assuredness or confidence. When you first qualify, your first client who may come along who has anxiety, for example, that'd be a very different experience for you as a therapist compared to having worked with 24 people who've come in with similar symptoms after 10 years. And your ability to embrace their experience with them is very different. And that's an intangible skill or way of being that maybe you're referring to.
We're able to kind of let them be whoever they are and feel whatever they're feeling without it necessarily overwhelming us or impacting us. We may have feelings in relation to what a client brings, but one of the things that I think has changed for me is that I'm much more aware of my feelings when I'm with a client and how to make sense of those. And I think that's something that, we start to think about in trainings and on placements. And then ultimately when we work with clients through supervision, that it's a really important part of what we do is that, it's because it's a relationship. The client, what a client brings will stir things up for us in all sorts of ways as well. And our job as therapists is to remember that we're there to do something for the client. And in order to do that, we have to work on our own stuff. I mean, through therapy, sort of before, during, or after our trainings, but then kind of on an ongoing basis as well, that we, in a way, are taking responsibility for our experience and our feelings in sessions with a client so that we can allow them to do something useful with their experience. And maybe that is something that only comes about by doing it, over weeks and months and years, that you then sort of in a way take in that way I described, that you learn something about that without necessarily setting out to do that, but just through that kind of cumulative experience.
One of the things I noticed during training when sitting with other people was that there was a sense of an emotional up and down. When you get the peak of a conversation and someone's whole physiology changes and then they come into themselves when they're talking about something uncomfortable, riding the crest of that emotional place that they were in was very different from trying to interpret what they were saying and thinking, oh, well, what does that mean that they've said that? Rather than just noticing how they were and also noticing how I was feeling in relation to them, riding that crest with them.
That sounds to me like it was a dynamic experience. Like there was something happening and there was sort of movement, sort of a relational, it was an experience you were having that wasn't sort of static. It wasn't just, this is how they're feeling now, I know it. It was something you were both involved in. The word psychodynamic contains the word dynamic, which is, I think, really important to reflect on, because the psycho bit is the psyche and the dynamic bit is things happen and things change, and there's sort of movement, and there are we can look at it in terms of a life, like there are many parts to a life through time, or even the present, and they interrelate. And when you throw other people into the mix, then you've got two people doing that, or a group of people. There's lots of dynamics at play. We can think about our characters as sort of being made up of parts, and we can have mixed feelings about things, and those might relate to our sort of experiences. And Melanie Klein, who followed on from Freud, talked about objects. So, I think what she meant by that was that the experiences we have, the relationships we have, past and present, the people we've known, past and present, we take them in some way. We learn something about the world through those experiences, and then we take those with us. So we can think about them as objects. That's what she talked about. What that really means is, I think different ways of thinking and reacting and relating. And within our own psyches, there are sort of these different parts, and they sort of react with each other dynamically as well. Not least given that what's going on in our lives changes in all the ways that we know it does. So there's this kind of constant kind of set of very sort of complex but dynamic things going on within us, and then obviously around us as well. And kind of getting inside that and trying to understand it as best as we can. That's really the task of psychotherapy or counselling, and the psychodynamic way of doing that sort of takes in those concepts as a sort of framework in which we can do that. And then in relation to transference, I think that there's a specific way of understanding that, which is something is transferred, and Freud talked about this. The ways we've learnt to go about the world and deal with whatever comes our way more or less well. Because we learn to do that in a certain way, we will repeat those ways of solving emotional or relational problems. And in a therapy, you can see some of that happening. So part of what a psychodynamic practitioner can pay attention to is what's happening here that might tell us something about what life is like for someone outside of the consulting room. Psychodynamic practitioners talk about transference and looking out for that. Is this client reacting or relating differently than another client might? Sort of trying to take everything into account, but sort of maybe looking for the ways in which they repeat something and then helping them to sort of understand that. Often a client will bring that themselves. They'll say, I always feel this, or right now I'm feeling, and you can look at that with them and think about how that relates to the way that they sort of go about the world more generally.
Within the session, they realize that they're repeating the patterns of their previous relationships in the consulting room with you. How does them realizing that help them then to move past it?
So, someone who is feeling depressed, might come in and, as you said, might start to understand more about why they're feeling depressed, why they're reacting in that way, at that point in their lives in relation to maybe something that's happened before. And that might be sort of news to them. That might be something they hadn't considered before. And so they've learned something about that experience of depression or whatever else it might be they're feeling. They've learned something about that they didn't know before. There's a term which is working through, which I understand as, in a way, coming back to this new way of understanding something, and in a way so you sort of have to practice understanding it maybe over time, so that a bit like riding a bike, you can take in the idea of it, but sort of actually doing it and feeling it and really knowing it might not come to you very easily. You probably still got the thing going on that you might be struggling with. So you're kind of trying to, build that awareness over time until you're able to kind of use it maybe for yourself in a way that you couldn't before. And that's something that I think I see happening in over time in a psychodynamic psychotherapy.
That sounds like the change that you're hoping to bring about. Because if someone's just, learning more and more, but how they feel isn't changing, is it really doing the thing they want it to? As
it continues to play out, which it might, because it's part of who they are, and they might continue to react in that way, but that they can sort of see it in a different light, and see that it's not necessarily to do with I don't know, their boss or their partner, or the person or the situation that's making them feel something in the present, but that it also relates to this thing in the past. And so sort of as they go, remember that again and again, and to understand that reaction or that feeling in a different way, and sort of work through it in that way. So that in a way they can sort of put it where it belongs a bit more, relating in a different way, or changing our behavior, or, understanding a feeling or a thought differently. In my experience, that takes time. We don't just jump on the bike and ride it straight away. We have to fall off it, like a lot of times, often.
And are there any experiences you've had where it's kind of spilled over into your personal life? So something that's happened inside the room has troubled you, and how have you dealt with that?
Often people are really struggling, and it can impact you. Sometimes people are feeling very anxious or very depressed. Sometimes they feel suicidal, and that's not an easy thing to work with and to sit with. Something I guess that I work really hard to do is to make sure I have the support around me that means I can work with people who are feeling overwhelmed themselves, or struggling, or may not be enjoying the therapy, or maybe feeling very ambivalent about the therapy, which is often the case. I wouldn't say it's sort of ever spilt over, but there have been times when I've had to take things to supervision that, I'm finding challenging. And then I use that supervision very well to help me work with that client, if someone is struggling in that way.
So if someone is feeling very ambivalent, as you said, towards the therapy, and that becomes apparent, how do you then address that? Is that useful content for you to explore?
It might, help us understand other things they feel very ambivalent or, mixed about in their life. And that, they might know, or they might come to know that they feel ambivalent about all sorts of things. And it's, I think that's something that can be worked with. I mean, it's hard to work with that, because if someone's saying, I don't really like being here, or I'm finding this really difficult, that can be quite difficult to sit with as a therapist or a counselor. But I think, in relation to what I said before about becoming more experienced, I guess I work differently with that now than I did before. And I'm sort of maybe more curious about it now than I was able to be, 7 or 8 years ago, when it maybe felt much more tricky to sit with someone who's feeling that way. And I can sort of bring a bit more of a kind of open-minded or curious, approach to exploring that with their client and seeing what comes out of that.
As a new therapist, working with that could feel like this isn't working, right? Or you could frame it in that way to yourself, but then later on, you could reframe that as this is an important part of the process, and having the confidence to sit with that and not panic. And I would imagine that would be something you'd learn as you grow. You
would go sort of through that together with them. Think about that too. If someone works through those feelings of ambivalence, they can reflect back on it later on and think about what might have been happening there as they build their kind of understanding and awareness. And again, that's the working through aspect, that they sort of have to go through that experience. That is often not an easy thing to do, and I think it takes courage on the part of a client. And I speak as a former client myself. You can feel very vulnerable. You can be, as you say, re-experiencing or remembering difficult things that have happened. It does take a lot of courage. And I think it's not easy to do that with someone, as counselors, as therapists. In a way, we make ourselves vulnerable as well. And, we might have lots of training and support and ultimately experience, but you still are there with the client when that's happening, and that's real. And while it's, really rewarding in lots of ways, it also isn't easy just to do that thing all the time. So I think it probably takes courage on both sides. And on some level, a kind of, acknowledgement that both the therapist and the client are, stepping into uncertainty and taking a risk in doing that. And but that there's enough understanding as to why that matters as well. So, and what's the role of the relationship between client and therapist in terms of its role in the healing process for the client? The one thing that a therapist or a counselor can offer a client is that they're a human being sitting with them, going, while they're going through whatever they're going through and working through it in therapy. And I'm not saying, all we're doing is being there as a human. I mean, we're doing more than that, but we're offering that thought and that shared experience, as another human. And, given that I think so much of what psychotherapy and counseling is about is to do with relationships, present and past often, as well as other important things that are happening. But often it comes back to relationships with other people. And we're doing that thinking in the context of a relationship, between two people, albeit set up in a very sort of specific way. But that's what's on offer. The therapist says, I'm going to offer you a certain kind of relationship. And that's the sort of the basis on which we're going to do this work. And I think that's a really important thing. There's the companionship, which is, I think, what you're describing almost in the being withness of the therapeutic relationship. But then there's also the qualities that, or the values that underpin the relationship that maybe people haven't experienced in their lives ever before. Someone who's just turns up every week, doesn't judge them for whatever they say. Some people may never have been in a relationship like that. I think ultimately there's something about a therapeutic relationship which, it's, although it's a very, it's obviously boundaried for very good reasons, it is about care and, it's sort of genuine care, because they're saying the thing that you're struggling with, the thing that you want to resolve, the thing that you want to kind of work through or move on from, it clearly matters. And it matters enough to me to be here every week with you and think with you about it in the way that we're going to. And I think that's a caring thing to do for someone. And you show that, by doing that thinking and the being with and the coming every week. There's a lot of scientific evidence to suggest, and I think people will make sense of this for themselves, that we need to care and be cared for as a sort of fundamental emotional need that we have. Freud would have talked about that in terms of drives, but there's a need we have as humans to be cared for and also to care for others. And I think people find that in therapy.
As far as you understand it, was Freud's kind of overarching project to bring a scientific understanding to the nature of the human mind?
Yeah, very much so. He was a scientist. He was a neurologist, he was a trained neurologist who then became interested in people's subjective experience of life and the world. He was trying to establish a link between the brain and the psyche, and he did his best to do that. And I think the fact he was interested in it at all and took it seriously in a way is the most important contribution he made, because he got people thinking about that. And also he obviously worked with clients. He was working in his own way. I know there are lots of people have a lot of problems with Freud and the way, what he stood for and the way he was working, but he was doing his thing in his time. And I think fundamentally what he was doing was trying to kind of establish that connection. And he was curious about it and, wrote a lot. And here we are now talking about, things in these terms. And I think it's, thanks to him that we are, because he sort of started something that other people then kind of picked up and ran with in the many ways that they have done.
Kind of broad church, really, isn't it? It's not like a kind of strict framework or way of thinking. It's more founded on that idea, really, of understanding the psyche and the dynamics that are at play.
If you're working as a psychodynamic psychotherapist or counselor, you can sort of see in what Freud was writing about and sort of make those connections directly. But there's been lots more thinking around that. And obviously, however long it's been, over 100 years of people thinking about it, bringing their own experiences, all those other people who've worked as psychotherapists and counselors and written about it and added to the body of knowledge, which we then sort of all have access to and can take in. So it's developed for sure. And, it develops at a high level with people who write about theory and practice, and it develops at an individual level as well.
Looking at the neuropsychoanalytic contribution to psychodynamic theory, where do you see that taking the field?
It's a big open goal there if people are interested in finding out more about how our brains work in relation to how our psyches work. My hunch is that it's going to become more and more relevant and probably prevalent in terms of any practitioner from any approach and how they understand their clients' experiences, because that's what it's about ultimately. It's helping, doing our best to help our clients understand their lives, their experiences. That has to belong in there. That's just my view. But
one of the challenges of psychodynamic work compared to maybe something like CBT is it's very difficult to prove its efficacy. We know that it can bring about tremendous change in people and bring about emotional regulation, but it's very difficult to prove that.
Beyond clients sort of self-reporting and saying, what difference they've noticed, but maybe as a sort of final point to bring lots of things together, there's some really interesting research done, I think, by a man called Shedler, Jonathan Shedler. And he's done research into, outcomes of different modalities. And what he's discovered is that whatever the modality, it's the quality of the relationship with the psychotherapist that indicates a good outcome, over the average. So that it's less to do with the approach and more to do with the relationship between the client and therapist. Now, you could say maybe the approach informs that, but, he'll say that CBT is more effective when the client says they had a good relationship with their psychotherapist. That's really interesting. We mainly in psychotherapy and counseling think about issues related to relationships and other people, as well as, transitions in life or events that happen. But they're often sort of focused on or located in our experience of relationships. And it's no surprise to me then that, at least in that research, even though it's qualitative, that's what's indicated as being a sort of a fundamental part of the therapeutic or healing kind of aspect of what psychotherapy and counseling are about.